Good afternoon and welcome everyone to today's webinar, Recognizing Infection Risk Session 2, How Germs Make People Sick. And this is part of a 3-session series on recognizing infection risk brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health in partnership with the CDC. Thank you everyone for being here, and thank you all for the vital role you play in healthcare. Before I introduce myself, I'd like to direct your attention to the chat, and there's a link for the pre-session survey. If you haven't filled that out already, please go ahead and do so. My name is Stephanie Doyle. I'm an infection prevention training liaison for Project Firstline Rhode Island and a community public health nurse coordinator here at the Rhode Island Department of Health. I've been practicing healthcare for over 20 years in many different roles, including direct patient care, management, and as an educator. Today, I'm here to present this topic to you and learn about your past experiences and how those experiences have helped you develop your approach to providing healthcare. These past few years have been so difficult for all of us professionally and personally. The pandemic has affected us all on many different levels. One important thing that we can take away from it as healthcare workers is that we need to stay vigilant and maintain high standards of care, especially when it comes to infection control. Again, I'm so happy to be here with you, and thank you all for joining me for this 20 to 30 minute refresher interactive session. All right. I'd like to, again, direct your attention to the chat and introduce our Project Firstline Rhode Island project assistant, Abby Anderson. She is behind the scenes along with our other team members, and she'll be posting links in the chat throughout the webinar. If you'd like to go ahead and introduce yourselves, go ahead and do so. Tell us your name, where you're coming from, and your organization. And I'm sure everyone is familiar with the Zoom platform. At the bottom of your screen, you'll see a few icons. Everyone is muted at this time. If you would like to speak, please raise your hand to be unmuted. You can see the raise hand icon there. There's a question and answer box for your questions. And we'll have a little question and answer session at the end of the webinar. And of course, the chat box. Feel free to share your comments and any questions or any experiences you can share in the chat. And if you haven't done so already, please feel free to add your email to be added to our distribution list. All right, very good. Nice to see everyone today. Thanks for coming. And our agenda today, we've done our welcome and our introductions. I'll go over our learning objectives. We're going to talk about how germs spread and make people sick. We're going to do an interactive session with some examples and scenarios and talk about the 5 elements of germ spread. And then we'll talk about how an infection can occur. Bring everything all together. We'll go over some important key takeaways. I'll have just a few announcements at the end. I'll ask for your feedback in a brief poll, and then we'll go over any questions you may have. So our learning objectives. At the end of today's session, you will be able to explain the 5 elements needed for germs to spread and cause infection, and also describe the 4 most common pathways for germ spread in healthcare. So how germs spread and make people sick. Of course, we know germs are everywhere, including in and on the human body and in the environment. Many of the germs that we come in contact with are normal and even keep us healthy. Our bodies are very good at protecting us against illness and infection, but when patients come into a healthcare setting, they're most likely weak or ill, and their defenses are down. They may not work as well. Also, some germs can still cause infections in people who are healthy. So in order to make someone sick, 5 things are needed. So we're going to just watch a quick 2.5-minute video, and we're going to see these 5 elements in action. Keep in mind that germ spread is not guaranteed to happen. Infection control actions at any of the points can help keep germs from causing infection. And as you watch the video, think about your workday, what you do and who you interact with, what you come in contact with during each day. And think about where you see the possibility of germs to spread. And feel free to share in the chat, or you can jot them down to keep for yourself or share with your colleagues. All right, so let's watch this quick 2.5-minute video, How Germs Spread in Healthcare.
There are 5 things that contribute to a germ spreading and making someone sick. Acting on one or more of them can work to stop a germ in its tracks and prevent infections. First, germs need somewhere to grow. We call these places reservoirs, which are simply places where germs live, a habitat, if you will. Our bodies have many reservoirs for germs. 4 of the most important for infection control are the skin, the gut, the lungs and airway, and the blood. The environment around us has reservoirs too. Water and wet surfaces, dry surfaces like countertops, dirt and dust, and devices and equipment. Recognizing where germs live is the first step in understanding how to stop their spread. Because when you know where germs might be, you can stop the risk and take action. For example, cleaning and disinfecting high-touch surfaces, which are reservoirs for germs, kills the germs before they can spread. Second, germs need a pathway. They typically can't travel on their own, at least not very far, so they get from place to place when they are breathed in, by touch, or through splashes and sprays. Many of the things we do in healthcare also create new pathways for germs by breaking down or going around the body's normal defenses. Think back to our IV example. Giving a patient an IV breaks their skin and creates a pathway for germs on their skin or in the needle to get into their body. But disinfecting the patient's skin beforehand and using a sterile needle helps ensure germs don't spread to the patient. Third, germs need a person to infect. That person can be a patient, you or one of your colleagues, or anyone that enters a healthcare facility. Infection control actions like telemedicine, screening, and phone triage work because they simply prevent people from being exposed to germs. The fourth factor of infection: when germs get to that person, they need to get around the body's natural defenses. People with healthy immune systems can often fight back. But for someone vulnerable to infection, like our patients who are already sick and struggling to regain their health, germs are an even bigger threat. And finally, the germ has to survive in the environment while it spreads to be able to make someone sick. Note that these 5 factors don't have to happen in this order for a germ to spread. It's very important to perform infection control actions at any point to help prevent infections.
All right. Now that we've talked about how germs make people sick, let's talk about how that usually happens in healthcare. So here on the slide, we have 5 elements of how germs spread and cause infection. So we have our 5 elements here. Take a good look here. We have our reservoirs, person, pathway, body's defenses, and germ survival. Let's look at these in a little more detail. As we do, again, think about your workday, how this relates to what you do, who you interact with, and what things that you come in contact with throughout your workday. So first of all, germs need a place to live. That is called a reservoir. It's like their habitat. It can be the human body, the skin, the digestive system, the gut, lungs, airways, and the blood. Germs can also live in the environment, water and surfaces that have water on them, moisture. Dry surfaces like countertops, bed rails, handrails, door handles, light switches. And they live in dirt and dust and on devices. So those are your reservoirs. Secondly, germs need a pathway. They don't typically move on their own. They need a pathway to move from one reservoir to the next. Germs need a way to get from where they live to another person or place, and we'll talk more about that in the next slide. Germs need a person to infect. Oh, if you can go back. That person can be a patient, you, or one of your colleagues. Germs also need to get around the body's natural defenses to make that person sick. And they also need to survive. Keep in mind, germ spread and infections can be prevented. Acting on one or more of these 5 elements can keep germs from spreading and keep people from getting infected. That is infection control. Now that we've talked about how germs spread and make people sick, let's talk about how that usually happens in healthcare. So we have our pathways, our 4 main pathways. Here you'll see those main pathways for germs to spread. So through touch, through contact. So think about, who are you touching? What are you touching throughout your workday? You're touching so many things, touching patients, equipment throughout your workday. And it usually involves the hands, the skin, but you could also touch devices, different people and surfaces. So germs also spread when they are breathed in, and also through splashes and sprays of body fluid, blood, or water from a sink or other source. Germs that are spread through splashes and sprays can get into a person's eyes, nose, or mouth, or in a cut or break in their skin. And the last common pathway for germ spread in healthcare is through the clinical care tasks that we perform. We're breaking down, in some cases, that first layer of protection, and that creates a pathway for germs to enter the body. Infection control actions at any one of these key points we've discussed can stop germs from spreading and causing infection. To make decisions about infection control, it is important to think about where germs are, which reservoirs are you dealing with, and how the germs might get from one reservoir to the next, the pathway. Then you can recognize the risk for germ spread to happen and do something about it, intervene. All right, so now that we've discussed the pathways and the elements, we're going to go through some scenarios, and I'm going to ask for your participation with this activity. So first I'm going to go through an example scenario of the 5 elements of germ spread, and then we're going to see a depiction of that in action. So this example, we're going to start with a germ and a reservoir, and then we're going to walk through each of the elements, and then we're going to create our own scenarios. Okay, so we have this scenario. We have a bacteria on a healthcare worker's hands. So this particular example is group A strep. So we have group A strep, and the reservoir is the healthcare worker's hands. So think about your 5 elements, your reservoir, pathway, person, body's defenses, and survival. So how is that germ on someone's hands going to make someone else sick? So here we have a depiction of the 5 elements in action. So the germ is on the healthcare worker's hands. You can go to the next slide. Thank you. So the germ is on the healthcare worker's hands. That's the skin. There's the reservoir. Then the healthcare worker touches the patient's bed rail. So now that germ is on the bed rail. And what can happen next? So the patient touches the bed rail before it's cleaned and disinfected. So here we have the person, the vulnerable person who's sick, in the hospital bed, and germ survival. And the patient touches their eye, bypassing the body's defenses, delivering germs into the body. So that's our example scenario. As you can see, the 5 elements in action. It's also important to remember that the elements aren't steps in an order, and that it's not inevitable that someone will get sick from a germ. Infection control actions can keep germs from spreading at any point. The reservoir or the pathway, the new person to infect, their body's defenses, and the survival of the germ itself. All right, so we'll see this slide again. We have our reservoirs: person, pathway, body's defenses, and germ survival. So now we're going to create our own scenarios. So we have some examples here. So we're going to go through each of these germs and reservoirs, and I'm going to ask you to create a pathway for this germ to spread. So as we go through, I'm going to give you the germ and the reservoir. So we're going to think of some pathways, persons to infect, and some body's defenses that this has to get by. All right, we're going to start with E. coli in the gut. So we have E. coli in the patient's gut. And please feel free to share in the chat. So we're going to walk through each scenario. So how can E. coli in a person's gut, how can that get to someone else and make them sick? How is that germ going to get from that patient's gut and make someone else sick? Yep, using the toilet, ingestion, improper hand washing. Okay, so yes, we have a patient with E. coli in the gut. They go to the bathroom and they don't wash their hands. Yep, not washing their hands after using the bathroom. Improper surface cleaning, absolutely. Okay, so E. coli in the patient's gut. Patient uses the bathroom and does not wash hands. So what happens next? So the patient with E. coli does not wash their hands. It's on their hands now. So we've created another reservoir. We've created the reservoir. Now we need a pathway. How is that going to get to somebody else? Yep, handling dirty clothing, touching doorknobs. They touch the sink handle. Touching food items, surfaces. They can touch another person. Absolutely. Preparing food. Touch a computer. Great, yep. Touching surfaces, bed rail, remote control. Absolutely. So this person doesn't wash their hands. They have an IV in their hand. I've seen it so many times. They don't wash their hands because they don't want to mess up the IV. They grab the IV pole and they walk back to bed. So now that E. coli is on equipment, medical equipment. Okay, very good. So we enter in another person. A nurse comes in to change the IV. So the nurse touches the pole to adjust it. Now it's on the nurse's hands. So we've created our pathway. So now how is this germ going to get to another person? That's next person to touch the unsanitized surface. Yep, anything they touch. So now, nurse treats another patient. Very good. Yep, if the nurse doesn't clean their hands. So the patient in the next bed calls the nurse. Help, I need something immediately, quickly. So the nurse goes into the next room. This person is receiving chemotherapy. Their body defenses are already impacted. So the nurse with E. coli hands this person some water. And there we have germ spread and infection. Yep, treats another patient prior to hand hygiene. All right, awesome. Very good. Very good. So we'll move on to the next scenario. And we have C. diff seal on a blood pressure cuff. So C. diff on a blood pressure cuff is our reservoir and our germ. And I'll ask you again, let's walk through this scenario. How is this germ going to get to another person and make them sick? All right, so we have our reservoir, C. diff on a BP cuff. Yep, can end up on the IV injection port and enter the bloodstream. The cuff isn't cleaned, yes. So the cuff is not cleaned, and the healthcare worker uses the cuff on a patient, and now that C. diff is on the healthcare worker's hands and the patient. Yep. Equipment not cleaned after use, not properly cleaning, BP cuff, absolutely. The cuff isn't sanitized properly. Yep, wrong cleaner, absolutely. Yep. A stethoscope too. Excellent. All right, so we have our reservoir. So now the C. diff is on the healthcare worker's hands and the patient. So how is this going to move to the next patient? How is it going to get through the body's defenses of the next person? Person with C. diff should have own equipment. Okay. Yep, so the healthcare worker does not wash hands, takes the pulse of the next patient. Okay, so we have the healthcare patient, healthcare worker, patient. We have a pathway. And then that patient grabs a snack on the way out and doesn't wash their hands. Possible scenario. Patient may have an open wound, the one that they use the blood pressure cuff on, absolutely. All right. Yep. And what are some examples of how the body's defenses are bypassed? What could make someone more at risk for infection? And that is our person and our body's defenses. Immunocompromised, yep. Underlying health conditions, chemotherapy, breaks in the skin, low immunity, absolutely. Open wounds, definitely. So this particular patient is taking antibiotics for infection. And then now we'll go one step further. What are some infection control actions that you could use in the scenario at any point so that person does not get sick? What are some infection control actions? I know you've already given some examples, but dedicated equipment, washing hands, PPE, absolutely. Wash hands with soap and water. Great, very good. Infection control actions. Frequent hand washing for residents as well. Great point, great point. Making sure you're cleaning and disinfecting before and after use. Bleach, cleaning with the proper cleaning solution, absolutely. All right, so we'll move on. Scenario 3. Thank you very much for sharing. These are some great answers. So here we have Pseudomonas in a wound. And we've seen this pop up in the media last week. We saw Pseudomonas aeruginosa contaminated eye drops. We had a big recall on eye drops. So think about that. And now here we'll talk about Pseudomonas in a wound. So we have Pseudomonas in a patient's wound. So how is that germ going to spread to someone else and make them sick, potentially? How is that Pseudomonas going to contaminate another person? Not cleaning hands after wound care, absolutely. Yep, so we have our reservoir, Pseudomonas in a wound. Not using PPE when doing wound care, especially if you know the wound is infected. Through hands or equipment being shared prior to hand hygiene, absolutely. All right, so during wound care, the practitioner is called away for an emergency, touches the door handle with a soiled glove. Okay. So how is that going to spread to another person? That's our pathway. And surfaces, we have our reservoirs now on the door handle. So how is that going to get to another person? Anyone who touches the knob unknowingly, they don't know that it's soiled, ungloved, touches the door. Yep. Yep, another healthcare worker leaves the room, touches the door handle, and proceeds to deliver food trays. Yep, Lauren, right on, right on topic. Delivers tray and touches. Yep, absolutely. All right, so then we need our person and our body's defenses. So this person with Pseudomonas on their hands, unknowingly delivering food trays, what kind of person body defenses are we looking at here? This could be in a nursing home where a lot of the clientele are weak and ill, compromised. So this person delivers the tray to a person who's on immunosuppressive therapy, and that person asks the healthcare worker for help with the meal. So now that's Pseudomonas. They're opening the utensils, they're opening food items, pouring drinks. Yep. Okay. So now that's a person going through the body's defenses. So in review, knowing where germs live and how they spread helps you recognize risk. Infection control actions. What are some infection control actions at any point in this scenario, this previous scenario, that we can take to limit the spread of infection? Education to staff, absolutely. What are some other infection control actions? Hand washing, PPE. We could put signage up, remind people to wash their hands using PPE, proper cleaning solutions. Removing gloves, and proper disposal. Yep, proper disposal of gloves. All right, very good. Yep, it's important to identify all risks, absolutely. All right, that was great. Thank you guys. Thanks for getting through those scenarios. That was excellent. So, in review, infection control actions at any one of the key points we just discussed can stop germs from spreading and causing infection. To make decisions about infection control, it's important to think about where germs are. Which reservoirs are you dealing with? How germs might get somewhere else, the pathway. Then you recognize the risk for germs to spread and happen and do something about it. So in summary, as we think about the scenarios that we just went over, and you guys did a great job in entering your comments into the chat there, think about your day-to-day work, what you do, who you come in contact with, what you touch, and how you can implement infection control actions to stop the spread of infection. Excellent job. All right, now we're going to bring everything all together for some reflection. Understanding how germs spread and make people sick is an important part of recognizing the risk for it to happen and choosing infection control actions that will keep germ spread from happening, which protects patients and yourself. Thinking about your daily work, can you identify any of your tasks that are related to any of the 5 elements? Go ahead and pop them in the chat. Related to your work. And take 2 of those actions with you to your next work day. Use them yourself or share them with your colleagues. Keep those in your thoughts on a day-to-day basis. And in conclusion, we're going to just review some key takeaways. We have the 5 elements for germs to spread and cause infection: reservoir, pathway, person to infect, getting around the body's defenses, and germ survival. The 4 main pathways for germs to spread in healthcare: touch, breathing in, splashes and sprays, bypassing or breaking down the body's natural defenses. Infection control actions at any one of these key points stop germs from spreading and causing infection. All right, so that concludes today's webinar. I'll just go over some brief announcements. So in order to receive your certificate of training, you'll need to fill out the pre-session survey, participate in today's webinar, and fill out the post-session survey, which will be emailed to you, and that closes on February 13th. And the certificate will be emailed to you on February 16th. Here are some resources for Project Firstline and our social media. And again, remember, this is part of a 3-session series. Session 3 will be February 27th, Monday from 12 to 12:30, Recognizing Risk Using Reservoir, a review. Here are our references for today's session, and we'll just ask you for a little bit of feedback, quick feedback, in our 3-question poll, and this will help us improve future training sessions and better support your learning needs. And we're a little bit over time, so if you have any questions, please feel free to email us those questions, and we will reply and get back to you as soon as possible. Again, thank you everyone for coming and taking the time to spend with us. Thanks for sharing your experiences. I really appreciate that.